Welcome, everyone. We're going to give folks just a few more minutes to join, and then we'll go ahead and get started. We'll just take a few more minutes. Okay, I think we're going to go ahead and get started. I recognize that a few folks are still joining, but for the purposes of time, we'll get started. Again, good morning, everyone. Welcome to the Early Learning Advisory Council meeting this morning. Let's see. Jessica, can you change the slide? Great, thank you. I think these meeting protocols are familiar to most, but just as reminders, just please make sure to mute yourself unless you're responding to a question. We do have Q&A dedicated throughout our session, but please feel free to make comments or post questions in chat at any time, and make sure that presenters come back to that. If you run into any technical difficulties, please don't hesitate to reach out to Jessica or Aaron at all. If you're able to, if you can change your screen name to reflect whether you're an ELAC member, a regional advisor, or a member of the public, that'd be great. And if you're not able to do that, that's fine as well. For the purpose of time for our introductions, we're going to put our introductions in the chat. So if you could please share your name, where you're located, and your role. If you're an ELAC member, if you're a regional advisor, if you're a member of the public, if you could introduce yourself in the chat, that would be great. And then we'll move on and review minutes from our previous meeting. Great. I see that folks are starting to introduce themselves in the chat. Wonderful. We'll just take another minute or so. Great. Well, please continue to introduce yourself in the chat, but I am going to turn it over to Lois, and going to take some time to review our minutes from our previous meeting. Lois, are you ready?
Yes, I am. Thank you very much, Enrica. Sorry that time just flew by, so thank you. So now we want to turn everyone, if you see, thank you, Jessica, has placed some information in the chat. And for those of you who may be attending for the first time, we're going to do a couple of things. The first is we're going to review the December meeting minutes, and we'll give our members a chance to vote in the chat, or you can also use thumbs up, which means yes, I approve the minutes. Sideways means I can live with them, or thumbs down means that you don't agree with the minutes. So just want to give everyone just 2 to 3 minutes to just look it over. If you have already reviewed the minutes, you can feel free to put your thumbs up in the chat or on screen. Are there any corrections or questions about December meeting minutes? Let's see, folk are still coming in. All right, thank you, Nancy. We have our first vote coming in. So asking again, members to please place your vote in the chat. Again, feel free to use thumbs up, thumbs sideways, or thumbs down. Aaron, if you would let me know, or Jessica, when we have all the votes in, then we'll move on to the next topic. And for those of you who have placed your votes, if you scroll up a little bit, you will see in the, well, actually, those are for the meeting minutes. Jessica, I guess we'll have to wait. If you would go ahead and let me know when we have enough, and then we'll move on to review our early learning legislative update, see if there's any questions for that piece.
Lois, so far, I believe we're at just barely a majority of the members present have voted. If any member hasn't voted on the minutes yet, please do so, but we're getting very close.
Okay. And then Aaron, if you would reach out to anyone who may come in a little bit later and let them know. So we'll move on then to our early learning legislative update. So that document is in the chat. It's a 3-page document, so I'll give people, we have a little bit of time, give people a minute or two to just to go through and see if there's anything they read that caught their attention that they may have questions about. I can say the one bill that stood out for me this session was 5774. Excited to have funding to make fingerprinting more accessible across the state. All right, no questions? Okay, let's move on to the state agency partner and regional coalition updates. And would love for coalition members, if there's anything that you're really excited about, that you want to share with ELAC about your report and the work that you're doing, please feel free to do so. This is a great time.
Hi, Lois. I will share from WCFC. I just actually wanted to give a shout out to all the folks involved in our coalitions and the work around the living wage proviso. We had an enormous amount of participation and listening sessions throughout the state and are still working to finalize the data received in those listening sessions and share that with our partner DCYF and then back out to our communities as to how that information is being used. But just a huge shout out and thanks to all of those involved and the work that they did there. I'm really excited to see the level of community voice being included in this work.
Colleen, since we have a minute or two, do you want to share a little bit about what the next steps are in this work? I know I'm putting you on the spot, but it would be great to hear.
No, that's great. And Nicole or Matt, feel free to chime in as well, because maybe I'm not aware of all of the uses of this, but from those listening sessions that were hosted, we are compiling the data. We did quite a bit of work throughout the regions to do an existing data landscape, which included analyzing various pieces of data that were out there, whether those were regional or statewide, and then really kind of getting to a consensus of what voices were represented well in that data, and more importantly, what voices were not. And then doing really strategic outreach to engage with organizations and or the communities that were, missing from that space, and hosting, intentional listening sessions or other similar activities to collect that data. Right now, our data lead is kind of synthesizing everything that came through in those sessions, and then we'll be sharing that, I think, in a report format back with DCYF. And then what I know of that is that that data will then be used to inform work that's happening at the CCA of WA Partner Roundtable, as well as some of the CCDF block grant planning, and ultimately the living wage proviso as it was passed by our legislature. But yes, again, Nicole or Matt, if you have more things to add there, please do.
Well, it looks like, thank you, Colleen, in the chat that Diana said she'll be covering this in more detail today. Melissa, and I know Matt, we're running a little bit more into your time, which we had promised we were not going to do after February. I do want to point out, I apologize. I don't know about you, but this time has gone so fast for me, but the meeting minutes were from February, not December. So excuse me for saying that. Melissa, just want to point you to Jen's question in the chat. For those of you who may be interested in seeing that answer, please go to our chat. And I am going to thank everyone. Sorry about my date faux pas. And Enrique, I'm going to turn it back over to you.
Thank you, Lois. I'm just going to do a very quick introduction here and then turn it over to Matt Judge. But Matt Judge is from DCYF, serves as the Federal Initiatives and Collaboration Administrator. And Matt will be providing us with updates and gathering feedback on Child Care and Development Fund, CCDF. So Matt, welcome.
Hi, everyone. Thanks for having me. As Enrique was saying, I'm going to give an update on CCDF and specifically the CCDF plan and the recent new rulemaking affecting CCDF, and get some specific feedback, hopefully around those new rules as they're reflected in the CCDF plan, but also just give you a general sense of the timeline and planning around our CCDF plan. So next slide, please. Just a roadmap for our discussion today. I want to start at the beginning and just make sure that we all have the background on what CCDF is, what its purpose is, what the purpose of the CCDF plan is, so you have a strong foundation in that. Many folks have heard a lot of this before, but for other folks it might be new, and I want to make sure we're all on the same page. Then I will talk about the CCDF plan process and timeline so that you have a sense of where we are and what will happen in the next few months and up to a year. And then I'll give you an overview of the actual CCDF plan. It's quite a large document, so I will just go over the major sections. And we have a very first draft of the plan that I'm going to make available to the group. But unless there's an outcry for it, we won't look at the specific plan itself today. Its scope is way too broad for just an hour, but I want to give you plenty of offline time to take a look at the specifics if you're interested in that. And then I have several feedback questions, as I mentioned, around the new CCDF rules and their requirements that are new to Washington State, because those are reflected in the plan. We're asked questions about those. And then I will tell you about next steps for the CCDF plan, and everything that's going to happen up until it becomes final. Next slide, please. So just to start way back at the beginning, what is the Child Care and Development Fund? Well, this is federal funding for child care subsidies and quality improvements. All the states have a CCDF grant. If you've heard of the Child Care and Development Block Grant, that is the federal law that created the CCDF fund grant. So when I'm discussing this whole subject matter, I just refer to it as CCDF for simplicity. So CCDBG, CCDF, we can consider as one and the same for our purposes today. The grant is overseen by the Federal Administration for Children and Families within their Office of Child Care. So I work directly with a regional manager and regional specialist, and these CCDF is broken up into geographic regions, and we're Region 10, and I work with their offices directly. CCDF was created in the so-called TANF reform era of the 1990s. The idea back then was that it would be a work support, but increasingly over the years, thanks to all the research and all the things that we know about family and child outcomes, it's increasingly focused on those. There's a major reauthorization in 2014 that really codified that new focus. Here in Washington State, CCDF is the major fund source for early care and education initiatives. The most obvious one is the Child Care Subsidy Program. payments to providers that are benefits to families and children are paid for mostly with the federal grants and some state funds and other funds. But we also use CCDF to pay for our licensing activities, a lot of our early achievers work, professional development. So anything early care and education at DCYF, CCDF is a major component. Next slide. So then what is the CCDF plan? What is its purpose? What does it do? So this serves as our application for those CCDF funds. So because, you know, that these are federal funds, there are strings attached. We're required to comply with the requirements of the grant. Those include the health and safety standards for any kinds of providers that might receive CCDF funds. Those include the eligibility requirements for the subsidy program. Those include background check requirements. And then we're also just required to to describe lots of other work we do that may not have a CCDF requirement attached to it, but they want to know what we're doing, for example, in the quality recognition and improvement system, just for example. So every 3 years, we produce a plan, and that's our application for the CCDF funds. And if it's approved, the CCDF funds are awarded for the next year. Now, it's called a plan, but in some ways that's a misnomer because it really isn't future facing the vast majority of the time. It's really asking us, what are we doing right now? Is that compliant with the CCDF grant requirements? And then over the 3 years of the plan's life cycle, anytime we change our programs, for example, let's say the legislature enacts a different income eligibility level in the subsidy program, and we have to change the subsidy program's operation that way. We also have to change the CCDF plan in more or less real time to show how we actually do our work and how that's still compliant with the CCDF grant requirement. So we're not saying like in 3 years, we're going to do X, Y, and Z. We're really saying this is what we do right now in licensing, in background check, in the subsidy program for provider payment. And so in that sense, it is a compliance document. You know, it's technical in nature in some respects. We're describing everything we do and how it's compliant with CCDF requirements. But because it's covering this broad system, the whole early care and education system across the state, you can look at the CCDF plan as a description of the whole system, not just with DCYF, but how we work with our partners. And so it just covers the entire breadth of ECE in one sense or another, with mostly a focus on, you know, what we might traditionally call childcare. And so you'll see less in there about, for example, ECAP, but there will be mentions. So as I said, if these are approved, then the CCDF funds are awarded for the next year, and I'm talking about federal fiscal years. So this plan will cover October 1st, 2024, the beginning of federal fiscal year 2025 through September 30, 2027, which is the end of federal fiscal year 27. Next slide, please. So here's the process. So it's kind of working backward. We're to have a completed plan by October 1st. Of this year. That means we will submit the draft plan July 1st, and then go through a period of review, working with Office of Child Care on any revisions that they request. Prior to that submission, at least 20 days before it, we're required by CCDF rules to hold a public hearing on the draft plan and receive comments. And then prior to all that, we're required by CCDF to do engagement with stakeholders. Each state is required to do it with their advisory council. So what we're doing right now together today counts toward that requirement. We're also required to get feedback from tribal nations. So that's going to happen as well. And then DCYF does lots of work above and beyond these requirements to engage on the CCDF plan. So more on that on the next slide. So recently I was having a conversation with Office of Child Care, the regional manager, my point of contact, about what CCDF plan engagement is for and what it actually is. And he reminded me that we do a lot of engagement as DCYF that speaks directly to work that we do in our CCDF subsidy program and licensing, and that all that actually is CCDF plan engagement, although we may not have officially said so or thought of it that way in the past. So that was really instructive to me. And so I just want to kind of pass that along with just the requirements that we are meeting in terms of consultation with ELAC and SEIU and IPEL. The access and living wage proviso listening sessions go right to the heart of what CCDF is about. Eligibility for families, increasing that so that families across the state are paying less of their income, their monthly income towards childcare so they can actually afford it. And then, supporting living wage and benefits for providers. Those are the two goals. Both of those go straight to the heart of CCDF. The federal priorities are around supporting, wages and benefits for providers so that families have access to childcare because providers are able to support subsidy, and increasing the eligibility so that more families are able to access it that way. So I really am thinking of that proviso engagement, all the things that Colleen just mentioned as a form of CCDF engagement, because it's speaking directly to those questions that the plan and CCDF raise. And by the way, I see Colleen's got her hand up, so I'll pause for a second.
Thank you, Matt. I appreciate pausing now before we got farther down the track. Just a couple of questions and thoughts or wonderings here. I hear you in the learning and recognizing that some activities that you're already doing can certainly meet the planning expectations and stuff that are put on DCYF, but recognizing that you yourself feel like you're just kind of becoming more aware of all of those things. I think that we really need to have some transparent communications around that, if these spaces have been existing, but maybe hadn't been publicly acknowledged or thought of as informing the plan, I think it would be really critical that we have, at least a document or some kind of communication that gets really explicit about where you're pulling all of that stuff from. Because if even you yourself weren't always thinking of it in that manner, that means that most all the public is pretty unaware of that stuff. So just kind of leaning into how we can be transparent there. And then also reflecting on the work with the living wage proviso and stuff like that. And just my personal experience with it. So please don't take this as across all of WCFC. But I don't feel that it was communicated in those listening sessions specifically anything about the block grant itself. There were, the confidentiality statements and things about how it was going to be used and who it's going to be shared with and stuff. But I do think that it would, especially for the work that I'm leaning into and the others that I work with, it would be important to go back to those communities and name that this information is being used to inform that, because I do think that's part of the reciprocal relationship and respect that we have with our communities, is to not only gather information and share that information to inform stuff, but to go back to the community and make sure that they are well aware of how and when and why their information was used. So just kind of, I've been in that thought space quite a bit lately. So thank you for giving me a moment to share that, but just thoughts that popped up for me as you were talking too.
Yeah, I appreciate that feedback, Colleen. I will say that we provided WCFC with some language around that. But, I think it's a delicate balance trying to support the engagement, and just explain what the proviso is about. And then with CCDF being a more technical aspect of this. But again, I appreciate the feedback that maybe it is okay to be a little bit more explicit and wade through the complexity if we need to together. That said, all the things on this slide can be thought of as engagement. Some may be formally discussed as such. And, we can take the feedback going forward about how to be explicit about that. I'm going to check the chat here and just make sure I didn't miss anything. Okay, looks good. Just this slide hopefully gives you a sense of our process and timeline. January through March here, we developed the plan for engagement, did a lot of internal drafting at DCYF to come up with our first draft. A component of the CCDF plan is the requirement that we conduct every 3 years a market rate survey or an alternative methodology. We are doing an alternative methodology to that. So as you may know, currently subsidy rates are set according to what we understand providers' market rates to be. We want to move to a system that sets them based on what it costs providers to actually do the work, to better support the work. So we call this the cost of quality care survey. Many providers filled it out, and we wrapped that up start of March. So the report on the findings of that will also it is also part of a CCDF requirement, and there's some discussion in the plan about what we learned through that survey. So that's kind of a component of the plan in a sense. Here, April through May, we will, as you know, doing access and living wage engagement. We're doing some of that just today here with Diana. And then this is the opportunity for consideration by ELAC, provider supports, IPEL, SEIU 925. I'm getting together with SEIU later today to talk about this. And, my thought is a written update for provider supports, but welcome feedback on that. We will have a public meeting. This is not the formal hearing, but an informal gathering. We'll cover a lot of the same ground, but just want to have the community have multiple opportunities to comment on the plan. Then once we receive those comments, we want to do a revision of the plan document. Then in June, we will have the formal public hearing. Again, another opportunity for a plan revision. And then we will do our final submission July 1st. Between July and October, we'll work with Office of Child Care on their requested revisions. And then around the same time, DCYF will be preparing the access and living wage status update. So I just mentioned that, it's kind of fortuitous timelines, the way things line up with the completion of the CCDF plan and that status update where we can kind of talk about the things that we've heard in the proviso engagement. And then if all goes according to plan, our plan is final October 1st. Next slide, please. So as I said, I will provide a PDF of the current draft of the plan. It's about 170 pages long in its current iteration. There are 10 sections now. There's been a little bit of a reorganization. The first section is really about what they call the lead agency, that is DCYF. Each state or grantee, tribal nations and territories are also grantees. They have a lead agency that administers a plan, and so we describe ourselves there and how we do our work. The next section is really on the subsidy program. We call it Working Connections here in Washington State. This is about the family eligibility and enrollment, continuity of care. They're really focused on families getting a full 12 months of eligibility, so that's described here. But also, each state has their approach toward what income eligibility is, what happens when a family goes slightly over the income eligibility limit after their eligibility period ends. So we describe how our Working Connection system works here in Washington in this section. Childcare affordability is really focused on what the Office of Child Care calls cost sharing. We call it co-payment. How is that affordable for families? Their benchmark is that co-payment should be no more than 7%, of course, of income for a family. We're meeting that requirement thanks to the Fair Start for Kids Act. So we describe how co-payments work in our state in that section. The next section really focuses maybe on the provider side of the equation, although the idea here is to ensure access for families and that they have plenty of choice in provider type, for what works for them. But some of that means focusing on payment rates. What is the rate of subsidy payment? What kinds of practices does the state engage in? And the idea here is that CCDF wants us to engage in payment practices that reflect the way the private market works. Again, so that providers are supported in serving families who are receiving subsidy benefits. The next section gets into the health and safety requirements, i.e. Licensing requirements and the requirements for license exempt providers like family, friends, and neighbors. So this describes, the 11 health and safety standards of CCDF, how the state has standards that align with those, how those standards are monitored in licensing visits and in visits to informal care providers. This section also gets into background check. How does the state comply with the requirements to do this, both in-state and out-of-state when a provider's lived out-of-state recently? That we meet all the elements, also that we complete our background checks within the 45-day timeline that CCDF requires, that, providers and their staff have an opportunity to, appeal a decision. So all those things are described there. The next section is really on, you can say, professional development might be the shorthand here, but everything we do to support providers beyond, including professional development and beyond, and make sure that they're well compensated. Next is quality improvement activities. So CCDF doesn't require states to have a quality recognition improvement system, but we have one. They ask us to describe it here, so that's a lot of what goes on in this section, but it's really everything that we are doing to support quality, broadly defined. The next section is around how we coordinate with other agencies, with partners, nonprofits, et cetera, to do our work. So yeah, I won't say any more about that. The next section is about family outreach and consumer education. A lot of this is about what information goes to families when they're made eligible for working connections, what information is available on DCYF's website, on the Family Search Center at Child Care Aware, for finding providers that meet family needs. Yes, also for learning about a provider's licensing history and anything that may have come up there. But also, program characteristics, so that families are able to find a provider that works for them. The next section is about how we make sure that we're good stewards of the CCDF funds. A lot of this we describe what we do in the subsidy program to check our eligibility work, to check that our payments are accurate. But we also describe here how we work with our contractors and vendors to ensure that all those funds are used correctly, how we're organized as an agency to support separation of duties, which helps with program integrity. So this is a large section. So that's the overview. In general, there's actually not a lot new in this plan. The major change came when reauthorization happened, and the 2018 plan and the 2021 plan had a lot to say about what we would do to come into compliance with, a lot of those new requirements, because there were a lot of big changes there. So we do have a recent change in CCDF that is less sweeping. Effective April 30th here, there are new rules. So I'm going to describe some of those next. So there are plan questions that are entirely new that relate to those rules. As I'll describe in a moment, the states are being given the opportunity to request waivers to come into those compliances as late as 2 years from their effective date. So DCYF will certainly be taking that up because we require legislative action to do most anything And we won't be able to do that until starting next session at the very earliest. But there are new questions around that, and that's the major like substantive change that I see. There's a new section on documenting compliance plans. So if there are any parts of CCDF that we're not compliant with, they just want us to list sort of a timeline and milestones for getting compliant. So we've always done things like that, but it wasn't formally discussed in the plan in this way. So that's kind of new. And then there's more of a cosmetic reorganization of plan sections. If you were around before and you dove into the plan, there used to be 8 sections, and they broke some stuff up and moved it around, and now they're 10. Some nice things, though, are that they've replaced some pretty bulky narrative questions that took quite some time to answer, that could have been more simply addressed with checkboxes and charts. So you see a lot more of those. That makes the work a bit easier, although the reorganization itself means that we have to track down the information and relocate it. So one step forward, one step back is my feeling on that. Next section, or next slide, please. So I'm going to give a very brief overview of the new CCDF rules, and mostly focus in on what's new to DCYF and new to Washington State. So we're really on the forefront of a lot of initiatives compared to lots of other states and territories and tribal nations in terms of going forward with CCDF priorities. So many of the new requirements we actually already meet. They aren't new to us. We've already been doing them. They might be new to other states that weren't. So the new ones for DCYF, just to summarize really broadly, the new rules require that we pay in our subsidy program based on the child's enrollment, not day to day. And they also require that we pay providers prospectively. So right now we only pay after the service has occurred and the provider bills to the SSPS subsidy payment system. Under these new requirements, we're no longer allowed to do that. We need to pay ahead. And that's, again, under that umbrella of payment practices that better align with the private markets. We experimented with enrollment-based pay during the pandemic. So we know a bit of what that's about. Prospective pay is something we're learning more about. Another new requirement, we're supposed to do early care and education services, not just through voucher. Our current program is, a voucher for the subsidy. They want us to, they're requiring us to do that also through grants and contracts, and then to focus that on 3 priorities: underserved geographic areas, infants and toddlers, and children with disabilities. Not clear what combination of grants and contracts are required, whether you could do all grants, all contracts for all those 3 groups. So we'll be learning more about that as guidance comes out. And then under 12-month eligibility, they're really just kind of ironing out any wrinkles in how the states are implementing that. So as you might know, right now in Washington State, if a family becomes eligible for child care subsidy, they get 12 months of eligibility. Great. But let's say a new child is born 6 months into that eligibility period. We keep the whole household on the same eligibility period, which would essentially mean that new child, if they're added to the case, would need to have an eligibility redetermination along with the rest of the household in 6 months. CCDF doesn't want us doing that. They want to make sure that the new child, that they themselves get a full 12 months of eligibility. So that's going to require a little bit of a change here in Washington State and many other states. Those are the main new requirements. Again, we're being given the opportunity to request waivers for these to extend up to a full 2 years from that April 30th deadline. So I fully expect, because of the legislative session, all these require new funds to do to a certain extent, that we are going to request those full 2 years to come into compliance with these new requirements. Next slide, please. I do want to at least toot our horn a little bit about the new rules that we're already in compliance with. Washington State, again, as I said, is a leader. We already cap copays at 7% of income under the Fair Start for Kids Act. The new CCDF rules require that all states do that. So that's something we are already compliant with. They also require that states pay providers subsidy rates in excess of their private rate if that's necessary to support cost of care and the price of quality care. In Washington State, we had already gone through a process where we requested permission to do the exact same thing. And we used what we learned in the Child Care Collaborative Task Force and their reports around the gap between the current subsidy rates and what it costs to provide quality care as the basis for making that happen. So we haven't been restricted to paying a provider's private pay rate or less in subsidy, no more than their private pay rate. We haven't been restricted to doing that for quite some time in Washington State. This just makes it official. All states should do that. We also already allow eligibility to be based on enrollment in some other program. Recent legislation said that eligibility in ECAP or Head Start counts as the approved activity in child care subsidy. There's another one around SNAP food benefits. So again, we've already been doing this alignment of some of our eligibility to allow folks to access multiple programs through one by being eligible in one.
So Matt, I see while you're pausing there for a moment, I see Lois has had her hand up and
Sorry.
So I just wanted to give her an opportunity to weigh in, and then I see there's some questions in the chat from Kathy as well.
Yeah, thank you, Nicole. So since you were on a roll, Matt, I didn't want to interrupt you, so I placed my question in the chat. So thank you. But basically, if you would go back a slide, I just wanted to know why wait for 2 years instead of asking for the funding difference in the upcoming session. Well, my concern being if a waiver's in place and we miss the biennium budget, it may be another 4 to 6 years before the state is in compliance. And enrollment base is not something that we haven't talked about. We've had work groups in the past that discuss the benefits of enrollment base. There's been work done on what the fiscal note would look like and all these different things. So I'm just not really understanding why we need to wait and again, going back to how long this can be put off for. If we miss this biennium, we know what short sessions are. Representative Liebert, I see she has her hand up, had talked about how it's just a grind for them during that time. So then we're looking at, 1, 2, 3, maybe 4 years or more before this fiscal influx can happen in the provider field. So that is concerning to me, especially again, since we know that research has already been done. The 12, all of these things are nothing new to our state. We just haven't put it into action.
So Nicole, I feel like maybe you might have the better, broader vision for addressing that question.
I'm happy to weigh in here. So we're actually going to talk about this when we talk about our it's a great question, Lois, and you're right. We do understand some of the assumptions and costs associated with this. And so it's something that we'll talk about in our draft decision package concepts, because we are going to have an ask in the 25-27 biennium to implement. Because even if we get a waiver, excuse me, we would need to implement at the end of FY26 and be fully implementing in FY27. But as we talk about that, I would just ask you all to be thinking about, is that something that maybe we need to think about asking for at the beginning of FY26 instead of at the end of FY26? So it is something we plan to ask for. just be thinking about sort of the time frame and amount we would ask for that.
So I see the representative has her hand up, so I want to give her a chance to respond. But I do want to say that the data evaluation was there. It's maybe the methodology may have changed a little bit, but you should be able to just dust that off and utilize it again. So I just want to encourage you to do that. Representative, thank you. Oh, she just left. Oh, no, she's back.
Is this a good time to jump in? Can you all hear me?
We can hear you.
So
Yeah.
we can hear
Oh,
you.
okay, great. I really appreciate the previous speaker's comments. In fact, that is too why I raised my hand. And I'm just going to speak frankly of my irritation with bureaucratic delay. And I feel that asking for a waiver is a good example of bureaucratic delay when folks need relief now. So I would not support asking for a waiver. I think there are many examples. This is just one of them that I've encountered over the last couple months with agencies or local jurisdictions wanting to wait. I'm not recognizing that there's harm in that wait. I concur with the previous speaker that we need to act now, and you should be asking now and not waiting until 2 to 4 to 6 years from now to get your work in order in terms of serving folks. This is too important, and we know that children, investing in children and early learning is one of the best taxpayer efforts that we can do, and a delay is suggesting that's not the case. So I think the data bears it out, and I would encourage you strongly to begin that work now and not ask for a 2-year waiver and delay it a couple more years. And a discussion is fine, but we need action fairly soon. Thank you.
All right. Thanks for that feedback. I'm going to move to the next slide.
Oh, Matt, before you move, I do see that Kathy has hand raised.
Yeah, thank you. And I'm actually going backwards, Matt. I'm hoping you can clarify something because I'm wondering if I misunderstood you. When you talked about the section on the quality rated improvement, I thought I heard you say that QRIS systems are not required, but that we have one, so you describe it in the plan. Did I hear you correctly? Is a quality rating improvement system not required?
That's correct. The federal rules don't require the states to, make participation in a quality recognition improvement system mandatory for receipt of subsidy payments. But of course, under the Early Start Act from 2015, that is state law in Washington. And of course, we're allowed to exceed CCDF requirements. So, yeah.
Thank you. I was under the impression that the federal government required that as well, but thank you for clarifying.
Yeah, I always try to clarify that. Yeah.
And I also see that Representative Levitt has her hand up, and there is a question in the chat from Colleen. Maybe we'll go to Representative Levitt first.
Apologies, I forgot to take it down. Sorry about that.
Oh, okay,
Thank you so
great.
much.
Then we just have Colleen's question in the chat. Are you able to see that question, Matt?
Oh, I'm so sorry. Let me pull it up. Is it this comment? I would say we need to ask for it as soon as feasible.
Yes.
The website. Okay. We know how impactful those changes were during COVID, and if the federal dollars we had access to, if I may ask, if DCYF had the dollars readily available, what would the timeline need to be to make these changes? So I would say I'm probably not qualified to make that determination for the subsidy program. I mean, the reality that we're working in is that the new federal funding is insufficient to cover the changes, and we would have to request funds from the legislature. I don't think, I
Matt,
think that a waiver of some kind would be necessary. We wouldn't make an April 30th, 2024 date in any circumstances.
oh yeah, I recognize that. I was trying to get more at just like, I guess I could ask the question more directly is what timeline does DCYF need to make the changes internally? I know you guys have to interact with multiple systems and stuff. So that was more my question is like that internal work that needs to happen. And if you guys don't have a response for that now, I respect that. Maybe that's something that could just get added to the feedback loop is that there's a rough estimation that it would take X amount of time. If the funding were just sitting in an account and you guys could get to work on it today, when do you think it would be ready? Just so that we have a clear understanding, if we request a waiver that covers us for 2 years, I think I'm hearing very clearly in this space that it's crucial that we still implement sooner, even if we have a waiver that's existing. And so having a clear understanding of the timeline that DCYF needs, and then obviously here in this space, you have a lot of advocates that would be at the ready to make sure that our legislature finds the funding for that sooner and has you guys in a place that you can implement much sooner than that 2-year waiver would be covering technically.
Okay, I'll be happy to follow up with our subsidy program and see what we can say about that. On that, the grants and contracts bullet, for example, we're still not sure the contours of what that requirement is, but so it's the timeline could depend on what the guidance is to us. But I'll try my best to follow up with some discussion of what we think timelines could be like for these 3 bullets. Next slide, please. Oh, we've gone back, I think. Oh, I didn't touch on, can you go back just one moment? There is a little bit of new flexibility that is kind of a new thing for Washington State. Just wanted to mention this as a good perk of the new rules. We are allowed to consider a child presumptively eligible for subsidy prior to full verification. We were actually already doing this in Washington State to a limited extent, where there was a household where parents had a new employment. It can be very difficult to get verification of employment when it's a new job. So we would give them 60 months to after attesting that they had that employment to provide all that verification. So that was kind of a form of presumptive eligibility that we're already doing. So it's nice to have that affirmed by the rules, but also to give us the opportunity to think about any other ways we might also think about, expanding presumptive eligibility. So that's an open question. We're also allowed to waive copays across the board up to full 150% of the federal poverty level. The limit had been 100% of federal poverty level. So it's great to have that flexibility. The Fair Start for Kids Act says what it says about waiving copays currently. So we have that in state law, but we're allowed more flexibility if we choose to go that direction as a state. Lastly, there had been restrictions on uses of funds for renovations. It was considered a major renovation and off limits for use of CCDF if you were going to change like a structural aspect of your facility, and so you couldn't use CCDF to pay for that. Now it's about a dollar limit. So if it's more than $50,000 in a family child care home, can't do that. But it can be structural and be below that amount and still be okay. The limit is 350,000 in licensed centers. So that's a nice just thing to have, that we can use CCDF more flexibly for facilities. Next slide.
And Matt, I see a question in the chat related to copays. Oops, I'm trying to find it. It moved.
I saw the question
great.
is, if we waived additional copayments, and Jason answered, yeah, waiving additional copayments would require additional funds to implement.
So for the feedback portion, sorry, before I move on, were there further questions on any of that?
That's what I'm checking to see if there are any other questions for you, and really appreciate you taking the time to address all these questions, Matt. I think there does look like there might be, oh, Nicole is responding. So I think we've got all the questions.
So I wanted to focus in because the new rules are kind of what's new about CCDF, that's new in the CCDF plan. These questions are focused on those 3 bullets that we were discussing just a bit ago. We broke these out into a smart sheet form. I guess, does that mean that we sort of break and folks go off into breakout rooms to do that? Maybe. Maybe I'll just follow up to. Sorry,
Yeah,
go ahead.
Matt, I really think it's entirely up to you and what works best for you
Okay.
trying to capture the information. It's 11:15 right now, and so we do have another 15 minutes, and we can even extend a little bit since we recognize we started a little bit late.
Okay. How about I just walk through the questions really quickly, and then we will break for about 10 minutes to jump into them. And then the smart sheet form, I think, can be made available offline or, outside of this meetings if the 10 minutes is not sufficient time to get in a answer to one of these questions. Does that sound all right to everyone? Just to give a little background on these questions. So focusing in on enrollment-based and prospective provider payment. So some states, like I think Texas is one of them, require a provider to disenroll a child who doesn't attend for a period of time when the state has implemented an enrollment-based pay system. I am just asking for advice about how DCYF approaches this issue. And then, within this context, what happens if the provider changes and, we're going to pay enrollment-based pay for both providers? Who should be responsible for reporting the provider change? So again, we're working to support families and providers here, but also be responsible stewards of federal funds. So that's kind of the context of that question. Sometimes children are authorized at 2 providers. How should DCYF handle enrollment-based payment in this situation? So more expanding on that topic. Next slide. The next couple questions are about grants and contracts. Do you have suggestions on whether to use grants or contracts? And I'm asking about, does grant or contract work better for underserved geographic areas, infants and toddlers, children with disabilities? Don't know if y'all might have opinions about sort of which approach to payment, if it might differ by those categories. And I just lost the presentation. Next, how do you advise DCYF to approach the issue of paying for vacant slots under a contracts approach? Is there a reasonable time limit for vacancy payments? So the idea here is there's a guaranteed slot, but we're using federal funds to pay for the slot that remains empty. So that's the obvious tension there. 12-month eligibility for children newly added to the household. Our expected approach is to extend the entire household authorization another 12 months. Do you see any issues with this approach? Any counters that you would suggest? Any issues this raises for you? So those are just my thoughts as to questions for the group. And so I will release you to check out the smart sheet. It sort of groups, it shows all these questions and numbers them, and then you select which one you're responding to, I think is the way it works in the smart sheet.
And Matt, I see a question in the chat from Deanne, just for clarification about the questions.
I'm so sorry, I'm slow here,
Oh,
not.
yeah, basically the question is wondering, are these mostly about the administrative process?
Yeah, I suppose you could frame it that way, although, impact to the provider and the family is, significant in these cases. But if you want to go broader and you have a question, a suggestion about the policy itself, that's perfectly okay too. This is just kind of what occurred to us to ask about.
I see, Deanne, you have your hand raised. You can go ahead.
Yeah, I was going to ask a follow-up question. I think there's a couple of these that I have questions about, whether there's administrative processes around informing the provider that might be coupled with the question itself. So in other words, as a former provider, I remember finding out with no notice that all of a sudden this child was no longer eligible, or they were moving somewhere else and I didn't know it. And so I guess there's two sides to this issue, which is I can imagine saying something like, I would want to disenroll a child after they haven't attended for X number of time. And that feels very different because it's more provider focused. But if a family moves on, what's the informing of the provider about that might address my question or help me answer the question around if they're enrolled in two providers or approved in two providers. Because I think that sometimes providers don't get told by the family, and what does DCYF tell? So just want to make sure there's that.
Yeah, that might be a legitimate approach to the question itself, is like, what should DCYF do to support the situation and in terms of informing? That would be valid. I'm going to post into the chat the link to the smart sheet. I'm sorry, I didn't realize that I was doing that. So hopefully this works.
So as Matt's doing that, Lois, I just want to acknowledge your question as well around grants versus contracts. And I think, this is a place where Matt has shared that I think we're getting a bit more guidance from the feds around kind of what this means and how states are implementing grants versus contracts. But when we think about a contract, it's thought that really is that movement towards a provider signing, like you noted, and they're signing a contract, and they're probably billing us a little bit differently. There may be some different requirements around that. So it is a little bit different, where we often talk about the working connection subsidy is maybe more of a voucher versus a grant or a contract. So hopefully that helps clarify.
Yeah, just to reiterate, technically, CCDF considers our program a voucher program. So what we do now currently wouldn't, qualify as a contracted slot. So if folks haven't already, the Smartsheet link is available if you want to hop over there and maybe try to wrap up some comments by 11:30 here. I will try not to encroach too much on other folks' time of the presenters.
Can I be sent back to room 2? I somehow sent myself back here. This is Kathy Carmen.
All right. Well, thanks everyone who's been jumping into the Smart Sheet. I'm going to go ahead and wrap up here just by letting you know next steps for the CCDF plan. As I mentioned, I will provide a PDF of the draft plan. I emphasize draft. There's still some missing pieces in here and a lot that needs to be revised for readability. But feel free to take a look and weigh in wherever you'd like. You can submit feedback and suggestions for any content by June 10, when we will have the formal hearing. And I'm open to the group's advice about receiving that. And I'm currently in the process of scheduling the public meeting and formal public hearing, but it's looking like beginning of May for the public meeting. And then probably on or just before June 10 for the formal public hearing. So more on that to come. Communications will go out, notice about those events. And then I can update ELAC at the next meeting about the CCDF plan or with a written update at your option.
And Matt, one question for clarification. When you say there'll be things open till June 10th, is that referring to the Smart Sheet that's open, or are you referring to other ways to provide feedback?
I've got no reason to close that sheet before June 10, as long as it's okay with my team. So I'll just keep it open.
Okay, that'd be great. I think that would provide lots of opportunity for feedback.
Great. Thanks, everyone, for your time and feedback.
Well, if there's no other questions from Matt, just want to thank you again, Matt, for taking the time to provide this really important overview, fielding all the questions that came up during the presentation, and giving the additional opportunities to give feedback to inform process. Before we move on to the next presenter, just wanted to draw your attention to a Mentimeter. Jessica put a link in the chat. We're trying to, during this meeting and meetings moving forward, to use different methods to just gather feedback to help inform future meetings. And so one way we're doing that is trying to gather some feedback real time. Other ways we're doing that is, we'll be sending out a survey to gather additional reflection. So if folks wouldn't mind clicking on that link and just providing feedback in the Mentimeter, that would be great. Just give a minute. See some responses starting to come in. I'll give another minute, and then I'll turn it over to Lois to introduce our next presenter.
All righty. Thank you, Enrica. And just, folks know that it's open. If you still have comments or thoughts, we all process differently. So please continue to add them into the Mentimeter. With so many of us either working in early learning or have children, nieces, nephews, we have all learned how to multitask. So I would encourage you to continue to put your comments in there. And at this time, I want to introduce Diana Stokes. Diana is the DCYF Early Care and Education Access Project Manager, and she's going to address some of those questions that we had shared earlier when we were talking about Colleen's work, and she'll just give us an update and how and what next steps are, as well as to, I would believe Diana addressed the question about how this information ties into the block grant or the CCDF grant, and what the plan is to return back to the community. So without further ado, thank you very much, Diana. It's all yours.
Thank you, Lois, and thank you, everyone. I'm excited to join you. I know many of you joined us last month for our special webinar, so I apologize that there is some duplication, but I promise you there's some new things here for you too, so bear with me. But we'll go ahead and jump into the next slide, as I want to lay the foundation of where we're coming from. So our vision for early learning here in Washington State is really to have an integrated mixed delivery system that's affordable, high quality, and it's available to all of our children, right? We want to support their child outcomes, school readiness, but also support the family's well-being. And this really aligns with our agency's strategic outcomes of reaching 80% of Washington children being ready for kindergarten, and working towards ensuring that all children have access, again, to that high quality early care and education, and that it's affordable. And while doing this, we want to ensure that we are eliminating racial disproportionality and advancing racial equity in early education. Next slide. And so the work that we're doing related to this really builds onto that. And as Matt mentioned previously, you know, we're working towards families paying no more than 7% of their income. But the other component when it comes to this proviso work is we want to ensure that providers are receiving a living wage and getting benefits. We have an existing foundation that we are building on as we move forward to this. Sorry, my puppy's wanting out. But as we move forward, you'll hear these connections as we lay that groundwork. Next slide. I'm sorry, Marlene. Hopefully my puppy won't interrupt anymore. As we move this work forward, we have some layers of this foundation. I really think of this as we build structures, right? We really have to get down deep, ensure that as we are building structures, you know, our pillars are deep into the ground. And so that way they're not teetering as, you know, we have strong winds and earthquakes throughout Washington State. And one of those ways to get there is through the cost of quality care model. I know in the past, Matt and Jason have really shared about this work, and we recently closed a cost of quality care survey that really is helping inform this. This is also connected to the early educator design team and their recommendations that they provided through Child Care Aware Washington in collaboration with Matt and Jason. As we look at what the cost of quality care looks like, we know that what providers are receiving is not enough to cover everything, right? We have the non-personnel costs. We know that there's overhead. We know that there are things such as that we just have to keep the building going, the lights turned on. We have a personnel cost. The majority of the cost for operating a program is paying our staff, right? We have ratios that we need to maintain, but we also want to provide staff with a wage that they are valued at. And we know that there is work to get there. Quality enhancements. You don't need just 4 walls to run a program, right? We need materials. We need curriculum opportunities, but our staff also need professional development opportunities, whether that comes in on a designated PD, you know, facility day, or if they seek that outside of regular operating hours on what limited time that they have. And so as we think about all of these different factors, our goal is that as we go forward with this cost to quality care model, that these will be reflected in the subsidy rate and the work that's happening there. This next slide is a visual that shows these different variables that are driving the cost to quality. So again, we know it's the salaries of staff, benefits, retirement, paid leave. We know we are engaging in families, whether that's in conferences or just in the normal drop-off pickup time. Planning release time, allowing teachers to come out of the classroom to do their curriculum development rather than doing it during nap time. We know that providing materials and curriculum can be very expensive. Anybody else feel inflation when it came to art supplies? I know I have in my own household. And then professional development support. So these are, again, different variables that are driving the cost of quality. And through that survey, we are able to see what are truly being paid for by providers today. And this survey went out to family home providers as well as centers. So that way we could see it on both sides of the spectrum, because we recognize that there's differences based on programs and the number of children that each program serves. Knowing that we have this cost of quality care work, we also know that the Fair Start for Kids Act really began to lay some additional groundwork for us. So this next slide is some language from the Fair Start for Kids Act. But I really want to call out that one thing that the Fair Start for Kids Act guided us to do is using a cost model. And that is something that cost of quality care model will get us to. Additionally, as we think about the access and living wage proviso and what's supposed to be happening there, right, we want to expand eligibility. And one of those ways is coming through working connections, as we know that expanded eligibility will eventually get up to that 85% of state median income. And I know Nicole will share a little bit more on this, but as we get to that 85 percentile, we still know that there's work to be done afterwards, right? Because again, we want to provide access to all families. As we move this work forward, and Colleen alluded to some of the work that she's been doing in connection to Washington Communities for Children, but we have been moving forward with some assumptions that were developed in partnership with Child Care Aware Washington, as well as other organizations that we have been partnering with through them. So this next slide will highlight some of those assumptions. We know that we are building on a previous system development and planning effort, but also incorporating extensive community input. We know that the cost of quality care rate model is the framework for achieving living wages and benefits. We want that those increased rates go towards paying workers. We're building on an existing subsidy system. We, again, already have that foundation. We're not creating a new program for childcare, but continuing to build with the existing system. We also know that moving this work forward, that we're not making changes to the childcare licensing standards or early achiever standards, as it's outside of the scope of the work that we're doing here. Instead, we're thinking about how do we increase access for families to have childcare and multitude of different options, as well as how do we get providers to a living wage and have access to benefits. This next slide is really, how does this all build together? So remember, I mentioned we were building these really strong, deep pillars. These pillars are coming through the cost of quality care rate model, the working connections eligibility expansion, and ECAP entitlement. These are things already in process that we are going to be seeing moving forward in the legislative session, and Nicole is going to share more about that during her time, so I'm not going to share too much right now, but know that these three really lay the foundation for access and living wage. So in order to increase access, we know we need to expand working connections, and we know more children will be served through ECAP entitlement. We know that by getting to that cost of quality care rate model and that being implemented, that's going to provide opportunities to get to that living wage and benefits provided. So those, again, those are the building of our structure and adding in as we move forward with these foundation of access and living wage. This next slide is super duper exciting, and it's the exact proviso language if you are interested. If you're not interested, some highlights is that by June 30th, 2025, we will submit an implementation plan that says how we're going to get to that 7% of household income for families paying for childcare, as well as what is it going to look like to getting providers the living wage and the benefits that they need. In doing so, we're not doing this alone. The proviso language does call out Childcare Aware of Washington, SEIU 925, but they're not the only partners that we're working with. We're also conversing with members of the public like you. We're meeting with family members, we're meeting with providers, but we're also working on future engagement too with licensed childcare centers. Next slide, please. So this work is not new, even though the proviso itself is new. So I like to think of it as the Fair Start for Kids Act really providing us a foundation and a kickstart to moving this work forward. Since then, there's been a lot of work happening. You know, we had the Child Care Collaborative Task Force. They worked on the cost model through 2022 to 2024. Matt and Jason engaged, and Nicole engaged with the early educator design team, getting their recommendations. Since then, we've gotten approval from the Office of Child Care to use an alternative methodology for our rate models. And we're continuing to build into this in 2024. So we have that cost of care survey. Bargaining with SEIU 925 is coming soon. And as Matt alluded to earlier, our timeline is a little wonky when it comes into the budget session, but we're working towards developing a status update that will help provide guidance on the direction that DCYF is going with the access and living wage work. And it really provides the connection to decision packages that provide that foundation. Then in June of 2025, we will submit that final implementation plan. Next slide. So as I mentioned, we are not on our own when making this implementation plan. So under that teal, we have a layer of green. And so we're working closely with Childcare Aware of Washington, SEIU 925, who's representing our licensed family homes. And then we're also working on opportunities to engage licensed childcare centers as well. But in individual outreach, we're presented to IPEL, ELAC, we went to provider support, but we're also engaging with DCYF staff, as we know that many of us are parents and utilize childcare or know somebody who has. So we really wanted to hear those voices and working with provider advisory groups. I'm going to dedicate my next slide to the work that we're doing with Washington Communities for Children, so stay tuned for that. But I also want to make a connection to the goldenrod color on the right-hand side of the slide. So while DCYF has the Access and Living Wage Proviso, Childcare Aware of Washington is also doing an advocacy campaign for childcare. And through their work, they are working off of recommendations and continued engagement with the early educator design team, but they've also formed a partner roundtable group, which consists of 10 different organizations throughout Washington state. And the work that they're doing in the roundtable group is similar to what DCYF and Washington Communities for Children are doing. And as we think about those assumptions, how do we engage? What are the policy questions that we need to ask? So as we write this implementation plan, how does this all actually work? How will we ensure that families are paying no more than 7%? How will we ensure that providers receive a living wage and the benefits that they should? So this is just a quick view of that. The next slide really shows the work that Washington Communities for Children is doing. And this is what Colleen was talking about a little bit earlier. So what WCFC has been doing in the last couple of months is they held listening sessions and executed a survey for family members and providers, asking them different questions. These questions were really focused on different categories of, you know, when you're thinking about applying for childcare, what are you wanting for your care provider? What are the things that you want to do? But one thing Colleen called out, which I absolutely love that we were able to do this, is there's been a lot of engagement that's happened over recent months and years. And sometimes we have a tendency to unfortunately ask the same question. It's not that we haven't heard, it's just there's a lot of information and data out there. And so Washington Communities for Children with their regional coalition really went through the existing information to find out who have we talked to, who have we not heard from, you know, what are the questions that have been asked, what are we missing? So that way we could be really intentional with this engagement and not provide a sense of overwhelm, because we recognize there's been a lot of surveys out and we didn't want to send just another survey when there is information that we can pull from.
Diana, while you're pausing there is a question in the chat. And just to find out, would you like for folk to wait until the end, or is it okay to interject as we go along?
Whatever works best. We can pause for this question right now.
Okay, thank you.
Yeah. So the question is, what is the accountability measures for providers that all these measures is resulting in higher wages and benefits? Will educators be surveyed, and are there other accountability measures? So I guess, Debbie, I'm curious to know what you're referring to specifically in regards to your question. I'm not sure if you're able to come off mute and provide some clarification.
Sure, I'm making a distinction between teachers or educators in the classroom and like childcare owners and directors, and trying to get a sense of what kind of accountability measures that this work is instilling to capture that data. And particularly, I can share with you, like we did a few of these focus groups that you're referring to right now in Snohomish, and there really were different voices depending on if you were a teacher versus a childcare owner, which, you know, is just really important. But yeah, I'm just curious. Does that make sense?
I think so. I would say in particular to the work that Washington Communities for Children did, we're still going through the data that was collected. We just got an initial summary the other day. So there are things that we are still reviewing. And then as the data comes in, I think we still have an opportunity to determine what's that additional information that we still need and what's that follow-up, because we're at the stage right now of going through that information and determining the best way to follow up and re-engage with participants, because we want to show them, like, we heard you. Did we incorporate this correctly? Is this what the intent was? So that, because there's been questions of how is DCYF going to use this information? You know, we want to show the partnership in developing this implementation plan and having continued conversations with those as well as others. So I would say we are still working on what those accountability measures are going to be, but we're trying to be very intentional of talking to the teaching staff, the administrators, all the different roles within programs. So hopefully that provides a little answer to your question.
Yes, and it wasn't in regard, my question wasn't in regards to this study. It was regards to your previous slide around the cost of living.
Oh, okay.
A couple slides ago, sorry. Yeah.
Okay.
The
No,
implementation.
I'm tracking now. Yeah. Give me my next slide, and if the question's still there, let me know and we can go back to it.
Thank
you. Yeah, but I want to pause because I saw, Colleen, you had your hand up, but now I don't see it anymore.
I was just gonna share that conversation, as I was understanding what Debbie was asking or talking around, was that conversation is more happening, I think, at the round table currently with the group of partners in really trying to work on the details. I don't feel as much that WCFC was tasked with or is doing the work in the work we've already done to identify mechanisms. I think the mechanisms piece is really happening elsewhere, but I'm not sure that I was understanding the question exactly, so I'll just pause there.
Yeah, no, that's helpful. Thanks, Colleen. And I'll just say, those are conversations that we are still very much working through with our timeline, the status update. I'll share in a slide here shortly about what will be included, but we have continued work that will support our implementation plan that will be due next June. Nicole, I want to provide you some space because I thought I heard you come off mute too.
Yeah, I think I was just going to say these are all fair questions, and Colleen is right. I think the roundtable is grappling with this. I think we're also trying to understand what this means at the state level as well. And so, as you all have thoughts about what could that look like, some of the questions we've tried to think through is, how do we make sure, if the subsidy rate is the mechanism, how do we make sure that the dollar gets directly to the teaching staff? And I know, and I see Lois just put something in the chat, there are so many different opinions out there about how this might work, and it is complex. And so we really, I think, are trying to take in everybody's perspectives and sort of say, okay, what is the best way we could potentially move forward? What are the things that might be barriers at the state level? So it's a to be determined, which I know isn't always the best answer, but it's the most honest answer we have right now. Is we're really trying to hear from everybody about how this might work. So thank you for the question though, and it's always helpful when people put in how they might want it to work, or also to hear how you don't want it to work, because that helps us think through some of those options.
Absolutely. Thanks, Nicole. So this next slide is really about how we are going to develop this plan in the sense of the modeling and the work that comes with it. So as a few of you have kind of put in the chat, when it comes to that 7%, who does that apply to? Is there any stipulations to that? That's actually one of the questions that we've been asking in these focus groups. So these are all great things that we're still working on figuring out. And so now that cost of quality care study has been completed, we're using that data to really guide us through the next couple of components. One of those is updating the cost of quality care calculator. So that way we are able to say, these are the things that happens. And then once the calculator is done, we have the rate models and the rate charts that are developed to show those changes. One of the recommendations for the early educator design team was changing the subsidy regions and grouping them by the cost of living versus being like geographically lumped together. And so we're developing two different models right now of what's the current rate in the current rate region, and then what would be proposed and included in the decision package for the cost of quality care. We're also working on uptake rates. And what that means is you know, how many more people would qualify for subsidy? How many more people would want to do subsidy? Is there a cap? Matt says this so eloquently of, you know, after so long, if you're making so much and it's only going to save you, say, $100, would you still apply for it, or would you just continue on and pay what you normally pay? So there might be where families choose not to participate. And so we're trying to figure out where all those numbers are at so we can think about how many families will be able to serve, but also how many more providers we may need, whether it's new programs or staff to support fully programs at full capacity. In partnership with Child Care Aware of Washington, they're doing a couple studies with Eco Northwest. They're looking at a cash flow study, which is thinking about what is sustainability for providers receiving different subsidy levels, and a feasibility study. So as we move forward with this implementation plan, what are the needs for the infrastructure and the cost for statewide implementation? And so those are components that are going to be feeding into the status update and implementation plan as well. Matt, I'm going to pause. Did I miss anything on that slide that you wanted to add to?
No, I think that covered it.
Okay. All right, next slide. So as we have these two report-like documents, we have two different timelines that we're working towards. So the first is our status update that we hope to have ready this fall. In it, it's going to include the decision packages. It's going to include the cost of quality care survey, which is also served as the market rate survey. And it's also going to identify any known dependencies and associated timelines for the implementation plan. And then the implementation plan, which is due in June of 2025, we're really going to come back to those decision packages and talk about the investments made in the 25-27 budget session about what does that mean for this implementation plan. We're going to talk about options for distribution of the living wage and benefits. So that does give us some time to continue having conversations on what the mechanism for that looks like. We're going to talk about the operational needs. What infrastructure do we need to continue to build up so that way we are able to support all of these families and these providers. That modeling that was on that last slide will be included in our implementation plan, as well as the recommendations that come forward from the work that's happening with the roundtable group, the engagement that WCFC has done, as well as DCYF has done, which includes recommendations and feedback from you all. And then in both, we will be leveraging the cost of quality care recommendations from the early educator design team. We know in order to move this work forward that there's going to be phased implementation. So this next slide just shows that we have the gears moving. We know that in order to move this work forward, as well, as I mentioned before, we have those foundations with those three decision packages. Those will help to support us moving forward towards implementing a living wage, increase the number of providers accepting subsidy, as well as increasing family eligibility to that 7%. But throughout this, I also want to call out and recognize that we need to recruit and retain qualified staff. Programs can't operate at full capacity if they don't have the staff to support that. And so that is something else that we're very mindful of, you know, what are the needs for programs and how do we support them in being successful in serving the families in Washington state. So my next slide, I want to pause. I appreciate the questions that have come in so far. I want to use this opportunity for you all to continue asking any questions that you have. And then I have questions for you all to go into in breakout groups based on any questions that you may have.
All right. Well, Diana, everyone's quiet, so I think that means they're ready to share out. So Jessica, if
Perfect.
you'd be kind enough to send us into our breakout rooms.
How much time are you
And then the
thinking?
next, oh, thanks, Jessica. The next slide includes the questions that I would love for you all to engage in today. Similar to Matt's smart sheet, there will be drop down. There are more questions, but I was really hoping we could spend our time on these questions in particular. So the first question here is, as we think about providers getting a living wage and benefits, you know, if we're able to do that, what are some other retention strategies that we could support on to ensure that we are able to fully staff programs? Non-standard options. So we know sometimes families need outside regular hour care, but what are other things that may need that we want to be very considerate as we put together this implementation plan? And then as we think about a coordinated system, so connecting children to care that meets their needs, what would that look like? And I recognize that you all bring many different perspectives. I'm really excited to hear the feedback based on those perspectives, because it's going to be very valuable. We have about 20 minutes. Do we want to do like 15 minutes, Lois?
Yes, let's do 15 so we can come back in case folk have anything they want to share out, as well as give us a little bit of time for the reflection.
Perfect.
So 15 minutes, see everybody when we return. Diana, as everyone is moving back into the room, can you share out how long the smart sheet will be available? Will it also, can we send this out the same way we are sending out Matt's smart sheet so that more folk have a chance? And if so, then what would the deadline be?
Yes, you can absolutely share out. That would be great. I want to provide enough time for everybody to be able to provide thoughtful responses and come back to it as we have other responsibilities. This is not a smart sheet that closes. So it can be, people can continue contributing to it realistically until about September if they want that much time. But if you need to give a deadline for your side of it, feel free to do so.
All right, thank you. So Deanna, do you have any, Diana, ooh. Diana, do you have any closing thoughts or questions for us?
I just want to say thank you, everyone. I appreciate the opportunity to join you all today. I will say this is not the last and only opportunity. I look forward to continued engagement in the future, not only as this work progresses, but also coming back and sharing how we are moving forward with that status update and implementation plan. So I look forward to reconnecting. And as I alluded to earlier, there's some things that Nicole will touch on too with her presentation. And hopefully, if you have questions as we make those connections, feel free to ask them, because we want to make sure that there's clarity. But thank you, Lois.
Thank you so much, Diana. And you see that Jessica has dropped the link in for the Mentimeter. So we have a few minutes before Enrica takes back over and introduces our next presenter. So if you guys would please take the next 3 minutes or so to complete the Mentimeter, that would be great. Thank you.
See that some responses are coming in, so I'm going to give about another minute or so before we transition to the next presenter. Okay, I think we'll go ahead for the purposes of time and move forward with transitioning to our next presenter. We have with us today Nicole Rose, DCYF's Assistant Secretary of Early Learning. And Nicole is here to provide us with an overview of timeline and preview of next steps for early learning decision packages. So I will turn it over to Nicole.
Thanks, Enrica and Lois and all. So you all were asking great questions as we are having our discussion today. And so we'll get an opportunity to talk through some very initial and very draft thinking around our 25-27 decision package concepts. And so if we want to go to the next slide, I'm going to share a little bit about what we hope to accomplish during our time together today. I want to share with you the agency decision package and agency request legislation process and timeline. And Melissa is also here. She is will weigh in if we have questions that goes sort of outside my scope here. I'm going to share with you some of the draft decision package concepts and connections to the FSK recommendations. And I want to share that what I'm sharing today are the decision packages that we anticipate we will be presenting to the DCYF leadership table from the early learning division. This is not representative of other decision packages or agency request legislation across the agency. And I try to put an asterisk next to items that seem like they were connected to the FSKA recommendation report. So you'll see those, and then hopefully have some time for questions on any of the draft concepts, or I know you had a little bit of time at the beginning of the meeting today to look at the great information. I said one pager, I think it's a little bit more than that, that Melissa put together on supplemental budget. So if you've thought of some questions that have come up from that, we should have some time to address those as well. So if we go to the next slide, this is showing you what our proposed decision package timeline looks like for the 25-27 biennial session. And I acknowledge that supplemental session just ended. We are in the middle of implementing all of the great things that passed from that session. And our teams are really thinking about what are the things that we need to do as we think about the next big budget session. And so there's been some conceptual development, and where it says LT, that means leadership table. So that's the DCYF leadership table. And then, so I'm going to present some concepts to you today that we're going to present to the leadership table at the end of this month. And then we'll go through and do a little bit more decision package development based on the initial decisions from that leadership table. Then we'll have another checkpoint within the agency where we talk about all of the decision packages across the agency. Then there'll be a final decision from leadership table towards the end of June. These are all required to be submitted to OFM end of August, beginning of September. And we are cabinet level agency, so we'll be in communication with our authorizing environment around sort of what we are submitting. So that's a little bit about the timeline. So I'm presenting some things to you before we've even been able to present them at the leadership table, but wanted to show you the things that we have been thinking about and some of the things that we've talked about together. So you're going to see some things that you've already seen before, including the next slide, which Diana just showed to you, but just want to draw your attention to a couple of things in here. So on the left-hand side, you see this reference to one, funding at the 85th percentile of the market rate, but two, that we need to be thinking about the move towards a child care subsidy cost of quality care model. And that's the early educator design team work that we've been talking about. This is in the Fair Start for Kids Act, and we need to submit some recommendations, and we'll be submitting a decision package based on some of those recommendations. So moving from that market rate to that cost of quality care. And then on the right-hand side, there's some pieces that Diana also talked a bit about. And this is, again, in Fair Start for Kids Act. And this is the continued increases in subsidy eligibility. So we had the movement from federal poverty level to state median income with the passage of the Fair Start for Kids Act. And then there were a couple of pieces in there that move us even higher in who is eligible for subsidy. And you see in July 1, 2025, that families up to 75% of the state median income will be eligible for subsidy. And so we'll be submitting a DEP for that. 85% state median income comes a bit later. That's in the next biennial session, but know that we're thinking about that as well. So on the following slide, Diana just showed this to you. These are the three things that I think we've brought here a couple of times, or to provider supports as well, really trying to talk about that when we think about how we get to that foundation of access and living wage, that we need to be thinking about the cost of quality care rate model, working connections, eligibility expansion, and ECAP entitlement, which is scheduled to happen in 2026-27, and that's school year 26-27. And that's when any family who is eligible for ECAP, who chooses to participate, would have to a spot if they showed up. So these are the three that we've mainly talked a bit about. And again, I said they're really foundational to a lot of the work that we're doing. And I want to introduce today a couple of other ideas, some of which you heard about in what Matt was talking about with the new CCDF requirements, and one that we've talked a bit about before in previous decision package requests, and that's really related to supporting some of our children in out-of-home placement through permanency. So the following slide shows you how we're thinking about these 5 things that I've just talked about. And I realized as I was making an update that I missed a spot on here, but we might think about ECAP entitlement, eligibility expansion, cost of quality care model, and the CCDF recommendations really as meeting some of the things that have been talked about, not only in the Fair Start for Kids Act recommendations, but the temporary licensing subcommittee tracker as well. You know, many of these items are really focused on the recognition, one, that access to high quality early care and education through childcare and preschool is really essential to our economy and self-sufficiency and child outcomes. That when we think about access to care, we want to make sure it's quality and that there's enough dosage or amount of hours in a day to meet both the family's needs and the child's needs to support kindergarten readiness. And a recognition that we really need to move from rates based on what the market can bear to the rates that are focused on the true cost of quality care. And many of these things are taking that additional step to continue to move our subsidy system a bit closer to the private market when we think about things like continuity of payment, enrollment-based pay, continuity of care. And then, as I said, we'll talk a little bit about transitioning child welfare, child care to working connections, child care as well. So all of these things, and I'll go into a bit more detail on them, so you can go ahead and go to the next slide, are things that we would be asking for across the 25-27 session. And so what we would be saying, so we just got done with the supplemental session. And so what we're saying is we want to ask for these items to start in fiscal year 26 and be funded in fiscal year 26 and 27. And so the first one is Working Connections Childcare. And this is an eligibility expansion, and wanted to provide you with what a family of three, what that income looks like right now. So a family of three, when you move to 75% of the state median income, that's about $75,852. And our best estimate right now is that would increase access to about 9,500 families. And the things that we to get to ECAP implement, and that includes continued movement towards increasing the ECAP rate. This session, we did just have some increases to the ECAP school day and working day rates. And we know that we have some more room to go there based on the latest ECAP cost study. And so in this ask, we would have the number of slots that we need to reach entitlement, which is about 4,400 or so, the rate increase, and then our quality supports and scholarships to meet entitlement. We would also have the cost of quality childcare rates. And as you see here, the buckets that are really in that rate, and that's the personnel, non-personnel, and quality enhancements. So we would be asking for these in each year of the biennium. So I want to pause there, Lois, and see if that addresses the question that you have. And actually, when I go to CCDF, maybe that will better get to your question.
All right, thank you, Nicole.
Yeah, because I'm realizing you're asking about CCDF. So again, we would be asking for each year in the biennium, so fiscal year 26 and fiscal year 27, for the funds in order to do all of these things. The next set of things that we would are thinking about asking for on the next slide. Get at Lois's question here around the CCDF, and it's listed as federal compliance right now. We should also maybe name this as making childcare work, right? Some of this is about how we're making childcare work, but it also happens to bring us into compliance with some of the new rules and requirements. So one of the things that we were thinking about here is that we would ask for this to start towards the end of fiscal year 26 and then all the way through fiscal year 27. What I feel like I have really heard from this group is that even though we might be able to request a waiver that would take us to the end of April of 2026, that we should really probably be thinking about asking to implement this at the beginning of fiscal year 26 if possible. And so I want to check for understanding, but I think that's what I've heard. You are saying, we think that you should actually ask for this across both fiscal years, not just at the end of fiscal year 26. So we would be looking at things like enrollment-based pay, prospective provider subsidy payment, and the grants and contracts that we talked about, and then 12-month eligibility. Enrollment-based pay is the one, as you all noted, that we have some experience implementing. We did that during the pandemic, and so we have some base assumptions about what that might cost us. We're getting some more information about what those other items might cost us, and we'll know more about that soon based on both guidance we get from the feds and the data that we're looking at as far as the number of families that we would need to do this extension on the 12-month eligibility. The last one that we have on here is child welfare, childcare, and fully merging child welfare, childcare subsidy with Working Connections childcare subsidy. So we do still have Working Connections subsidy, and then for some of our families who are in out-of-home placement, they're accessing childcare through child welfare childcare subsidy. And what we would really like to do is bring these childcare programs together so that we have one childcare program. And while we're doing this, really think about how we are providing continuity of care for our children who may be in out-of-home placement, and supporting them with access to care through out-of-home placement all the way through permanency or adoption. And so we are working closely with our colleagues in the agency who are in the child welfare division to look at sort of what is the average length of stay through permanency, so that we can better estimate what this looks like. And I think we all know, as we think about high quality early learning, that there are great benefits around kindergarten readiness and resilience, but it's also a great preventive and protective factor for children. So we are wanting to ask for that to bring those two things together and increase the amount of time that families involved with child welfare may be eligible for child care subsidy. So I want to address the question. So July 1, 2025 is actually the start of fiscal year 26. So fiscal year 26 actually runs July 1, 2025 through June 30th of 2026. And so we are trying to ask for that to happen right so what I hear you saying is you would like us to ask for that right as the end of session as they're looking at the 25-27 budget. And I know it gets sometimes I have to say the fiscal years and the months and all those things out loud in my brain because I get a little confused about them myself. But July 1, 2025 is FY26. So completely hear the ask to try and do that as soon as possible. Yeah, and Kathy, on enrollment-based pay, and that, like I said, we know how to do. On prospective payment, there are a couple of things that we're researching there about what it will take to do that. We're trying to better understand if that is just a rule change or if we actually need a CW and law change to do prospective payment. And so these are all things that the team is engaged in as we work to really understand, one, what, if any, complexity is involved in implementing these. Two, the other thing I really heard today is being really clear about when we can implement when, and noting that, because sometimes there are system development that takes time. And so we've got to look at what are the things that we're implementing now and how long would it take us to implement some of these new items, which we'll take into consideration as we look at all of these concepts. So I did not create a smart sheet. I apologize. But I thought maybe we can just maybe have a discussion, or if you want to keep putting things in the chat. My wonder is, how do these resonate? Are there other things that we should be including in these that I didn't share? I really hear the need to look at those CCDF requirements. And I think, as we think about enrollment-based pay and the cost of quality care, kind of those two things together can really help stabilize payments that are going to providers. So yeah, I will just pause and see if there are any initial reactions or things that you're thinking about, or also open it up if you've looked at the great information that Melissa put together, if you have questions about the 24 supplemental budget.
Nicole, I do see a question in the chat that I was not sure if it's been addressed yet. from Deanne.
Oh, yes, I see that. Okay, so contracted slots, will they specifically be used for infants and toddlers needing short turnaround placement for by child welfare? So let me actually talk a little bit about something that just passed in the, excuse me, in the supplemental budget. So there were funds through the opioid abatement settlement funds that actually have 100 contracted slots, in particular for infants who may be impacted by substance abuse. And so we're also working through with our child welfare partners about how exactly we implement that, how we look at some of those high needs areas. But Deanne, to your point, I think, you know, as Matt has shared, you know, as we are looking at how are we sort of operationalizing what the new CCDF requirement means around contracted slots, I think that's absolutely a place that we would want to hear from you all around where and how might we prioritize doing contracts with providers. And so infants and toddlers who are in out-of-home placement, maybe there are other high needs areas that we need to look at. And I think that's a to be determined that we would want to be connecting with you all about.
Just to say a couple of things more, it just seems like when there is a connection between a referring organization and slots, it can be a super helpful winning partnership between a provider and that organization. Whereas if it's sort of contracted and left to the provider to do a lot of the marketing, might not be as functional as you might like to. Not to say that it wouldn't work, but I'm just saying it just increases the likelihood of, I think, key success. And I think it's fair to say in almost every market, infant toddler slots are short. So that's why I put those in there, because I just feel like those kiddos are the toughest to place. We get calls on the call center all the time where they need a short-term turnaround placement for, especially, you know, a 6-month-old, 18-month-old, and those slots in almost every market are near to impossible to find. I know you know this, but I just feel like trying to increase the likelihood of success as we roll out contracts by thinking it through, how do we get this connectivity really tight, is worth our time and effort.
And I think you're highlighting something that, you know, Lois, when you were asking your question about, I think, around contracted slots and grants versus contracts and some of those pieces, in the bill that Melissa put in the chat, part of that contracted slots and part of the funding is how do we have a contract for providers maybe to hold a space open? And so that can be the difference between a contract and really then a voucher, right? And so it's thinking about, okay, are there places where we know that we want to say, hey, here's this contract. We want you to hold some capacity open in case there's placement. And so that can be some of the advantage to doing contracted slots. The other thing I just want to note is Deanne was talking around those connections and connecting between essentially a navigator and a provider, and the Family Resource Center can act as that in some ways, but we also have in DCYF our child welfare early learning navigators, and those early learning navigators really have been focused on what we would consider some of the front end services. So some of the voluntary services before a child is in out of home placement, but there was, we have expanded that work to try and get some early learning navigators in all of the regions to try and do some of those intentional connections. So that's a good call out and reminder as we think about these pieces, how we are working really closely with those navigators and making sure they know our Family Resource Center and then also the providers in their area.
So Nicole, for that, to follow up on Deanne's, what she pointed out about having the contracted slots, do you think that that would be, are you going to look at childcare deserts, or are you going to basically look at placement around areas where there seems to be a higher need. You know, and then what metrics would be used to determine what areas are quote unquote a higher need.
Yeah, that's a great question, Lois. So one of the things that we have looked at in the past is we've looked at some of our DCYF dashboards around supply and need and access deserts, and we can look at access to infant and toddler care in particular. We have been doing some work around high needs areas, and as we're doing that, I'm thinking that may be something that is good to bring to this group and to provider supports around some of the thinking that the Office of Innovation Alignment and Accountability has done around high needs areas. And that has been a combination of looking at where are we seeing kindergarten readiness scores, kindergarten readiness outcomes, excuse me, that we need to increase. Where are there maybe high rates of maltreatment? We have previously the 23 locales of the highest rates of child abuse and neglect. And there are a couple of other things that we've looked at there. And I, again, would welcome thoughts from you all about what else we should be considering as we think about where to place contracted slots. And I see some chatter in the chat. So I posed a question in the chat as well, as you all are sort of thinking about what would those financial incentives look like. You know, there's been increases in the infant rate incentive. We also know, as we look at the cost of quality rate model, that looking at the infant and toddler rates in particular is really important. So again, any input you have on sort of what those financial incentives might look like would be great. I do want to reiterate, as I dropped these concepts in the chat, that these have not yet been approved by the DCYF leadership table. They are our draft concepts that will be moving forward, but wanted to get them in front of you all just to see how they resonate. Really helpful feedback on the CCDF components for us to be thinking about trying to implement that as soon as possible. And I know now that I'm standing between you all and probably your lunch, or getting up and moving, or going on to your next meeting, or playing with children. So I want to be really respectful of your time and just really appreciate the opportunity to be with you all today.
Well, thank you very much, Nicole. And I just want to extend our gratitude to Nicole and the team. We have advocated for coming to this group before the budgets are drafted. So Enrica and I, and on behalf of ELAC and our RAs, want to thank you all for doing that. Melissa, and your work too, for pulling everything together. It's very helpful. I will ask Nicole if for you the same thing. There are a lot of comments that I don't know if folk will put your comments in the chat, if you want to copy them and move them over into the Menti, that might be helpful. And if you want to expand on them, I do. Nicole, when will this close? I know we have the feedback loop, but do you have a time frame as well, so folk know what their deadlines are?
I do. So these, more work on these drafts is actually due to me from my teams by the 15th of this month, because these are due to budget, I believe, on the 22nd of April, and we're presenting them on the 29th to our leadership table. So I would say you could have until about the 15th. We can maybe squeeze in a few things after that 15th timeline.
Okay, thank you. So ELAC and RAs and our community members, we have our deadlines and our marching orders to be able to have some feedback on that. So before I send us home, I'm going to ask Enrica if she has anything she wants to share and to wrap up this topic.
No, I don't have anything further other than thank you, Nicole, for taking the time to provide this overview for all of us.
Thank you all.
All right, so we asked everyone if you would just take a few seconds. We have you for maybe another 45. If you would just please complete the Mentimeter. It's very simple one that just asks, did you feel like today was a good use of your time? Our next meeting is a report development session on May 14th. And then our next public meeting is scheduled for June 4th. So I just want to make sure everyone has those dates on your calendar. We thank you all for attending today and hope that everyone has a lovely spring as we move into our summer months. So we'll see you all in May.